or micro ways of overcoming them. And you can overcome them. I think that is, if I want you to take away anything from this presentation of mine today, is that if you think you have these issues and if you think you're running around in circles and you don't see a way out, well, there is a way out. And the way out is, in my experience and conviction, is communication and allowing yourself to recognize that you might have an issue and that you can find help for it. So bringing it back now a little bit to, in particular, the situation that PhDs and postdocs find themselves in. I see some calls to be optimistic there, because there is a lot of willingness from the different institutions to support people in this time. So in the last couple of days, I have checked and I've seen statements from organizations like the DFG, the DAAD, which is the German Academic Exchange Service, and also the EU itself. The German government has only yesterday released a policy change that they will extend contracts for researchers in training. So sadly, this probably does not include postdocs, for up to 6 months. So for anybody who's feeling pressured right now that their contracts might be coming to an end, that there are deadlines to meet and you have no idea how to do those last sets of experiments, institutions and organizations are aware of this. They are making these preparations and provisions for people to take the additional time if need be. So please don't let that be an additional burden on your mental well-being, because there is the recognition that this is a problem and things are being adapted to the current situation. Now, obviously, there will always be individual cases that are slightly outside of the norm or unusual and unique. So try to address them with your supervisor. There's no generalized advice I can give in that regard. But talk to each other, talk to your bosses, to your supervisors about this. Another reason I think to be optimistic is that I think the PhD, possibly also the postdoc, is a type of profession or occupation that perhaps is a little bit more resilient than other trades to the situation we find ourselves in. It does give the opportunity for self-study, for reading those papers you never got around to, for starting the introductory chapter of your thesis, perhaps. So it's not necessarily lost time. But when I look at the comments on the side here, that doesn't seem to be much of an issue. It seems to be much more so the problem that people find that they need to do much more than they have the time for. And I think everybody recognizes that this is extremely unusual how ineffective or unproductive we are. I mean, I'm finding that I'm sleeping a lot more. I'm a lot more tired than I usually am. I'm normally an insomniac. So this is a truly strange effect of this isolation. So let me just see, I have a couple of notes. I think a lot of the things I wanted to get across I've already covered. So, so I might have a relatively short presentation here. I do want to address one of the questions I've seen coming up. And I'm not going to mention the name, but the person says that the supervisor expects to get her to get a lot of work done, and she's having a hard time to focus, and how does she communicate that to her supervisor? Now, this is something I recognize from my professional day-to-day, let's say. I often have PhDs and also postdocs coming to me saying, I've got this or that issue with my supervisor, how do I approach it? And my first question is always the same. It is always, have you talked about it with your supervisor? Now, 9 times out of 10, that person will say no. Now, how do you expect your supervisor to know how you feel or what you want or what you can or cannot do if you don't communicate it to them? And I recognize that there's often this hierarchical feeling, and certainly this is very much the case in Germany still, that perhaps, you know, you shouldn't be seen to making these sort of upward statements of, I'm the lowly PhD student here, and I think I should be doing things different than you suggest. And certainly you shouldn't go into a conversation like that. But you can always talk to your supervisor. That's what they are there for. And they can't help you unless you discuss it with them. So to the person who answered this question, how do I communicate this to my supervisor? I think you should communicate it precisely in the way that you have posed this question here. And I think you will probably be surprised in most cases how willing people are to support you, how willing they are to listen to you. You know, we're all people, we are all interested in collectively getting the best results out of a situation. So with that, I think I'm going to wrap up here. And I just want to highlight the issues that if you find yourself stuck, there is a way out. You can turn this corner. I was somebody who worried about everything to the extent that fear was dominating my life so much that I could barely set foot outside to go to the supermarket. So I was in a self-imposed quarantine in what probably should have been some of the best years of my life. And I very much regret that. And the moment I chose, and of course, this only happens once it all comes crashing down. But you can possibly avoid that by recognizing it early. But the moment I chose to address this problem, you know, I found that yes, you can turn the corner on this. And now I'm a person with a pretty optimistic view on life. And I think, and I firmly believe that this pandemic will be handled, will be solved by the use of science. I also see this as an opportunity for science to prevail, where in recent years there has been a very worrying trend of science denialism and criticism of the experts. And you know, when you see what criticism the WHO is receiving from certain corners today, this is all very worrying. But I'm positive that science will prevail, that we will save the day, that also the recognition of the importance of scholars and scientists stands to benefit from this, that perhaps working conditions like the healthcare workers will look better after we've turned the corner on this pandemic. And likewise, if you are struggling on a personal level with anxieties, with depression, there are ways of dealing with this. Don't be afraid to reach out for the help that is available there for you. You can use this time to address those problems and come out of it the other end. And I would like to end on that note, really. So perhaps the moderator would like to take over.
Yep, thanks so much, Hendrik. That was fantastic, and it was really nice to hear your personal journey. And I really like your point about putting a positive spin on this whole situation and really seeing it rather as an opportunity to really bring a lot of issues to the forefront that maybe haven't been dealt with before. And your message about being that there is a way out, and that this way out is communication, and that we can find help, and that afraid to go and see a professional about our problems. And I often say to people that, you know, if you break your leg or if you have a really bad infection, we usually don't hesitate to go and see a doctor immediately. So why is this not the same for our mental health? So yeah, it's really nice. Thanks so much, Hendrik. And so we're going to move on to our third and final speaker, and it's a huge privilege to introduce Dr. Nicola Byrom, who's with us today. She's a senior lecturer in psychology at the Institute of Psychiatry, Psychology and Neurosciences at King's College London. And she is also the lead of SMARTN, a large national research network which focuses on student mental health in higher education. And she's also a founder and a trustee of Student Minds, which is the student mental health charity of the UK. I think she's going to talk a bit more about those, and she sent some links also in the chat for all participants to check out. So without further ado, I'll pass it on to you. Thanks.
Thank you. It is so wonderful to be with all of you today. It's fantastic that there's so many people listening here. And I want to say a huge thank you to Desiree and Hendrik for sharing such wonderful advice and ideas and suggestions. And Desiree, you've definitely perked my day up and helped me feel a little bit better about myself. Just before I get started, has everyone like me just been sitting here for the last hour or so, still at the computer? And if so, I'm just going to encourage you perhaps to stand up for a minute and roll your shoulders around and just give yourself a bit of a shake. Perhaps have a look out the window and a deep breath, because sitting still at a computer for a long period of time doesn't do any of us much good. But so I'll give you a window to have a bit of a shakedown. I'm sitting here at my desk surrounded by notes, post-it notes of ideas and things that I wanted to say, and I've busily been crossing them all off as I've been listening to Desiree and Hendrik. They've covered lots of the points I wanted to go through. So I'm hopefully going to have a nice little short talk wrapping up some ideas, because we've already had lots of fantastic advice. I'm interested in Hendrik's points about the German situation around understanding around mental health and discussion of it in academia. And so just picking up on Elliot's point, if you want examples and illustrations of what's happening elsewhere, we've really had a big push in the UK to look at student mental health and postgraduate mental health in particular. Our government's Office for Students funded universities a few years ago to look at postgraduate mental health in particular. And I was funded through that to put together an online resource that I've shared on the Zoom webinar chat, which is called the Wellbeing Thesis. You can find it just as the wellbeingthesis.org.uk. And this is a project, an online support platform that we put together following lots of consultation with PhD students, trying to think about what challenges they were facing and how we could help. The platform's been written by a counselling psychologist. So lots of expert advice and suggestions on there. So I'm just directing you to that in terms of after this chat, you might find it helpful to have a look at that. There's lots of ideas and suggestions there to help you work on your PhD and help you look after yourself while you're studying. I've been asked on this call to have a think about how you can identify anxiety and depression, perhaps distinguish mental health difficulties from everyday anxieties and concerns, and what we can do if we are feeling anxious and depressed. And I just wanted to start that by echoing the points that Desiree's already made, and that this is a really unsettling and challenging time. Whatever the situation you're in, our worlds have been turned upside down. What we thought we knew and understood is really being challenged. We're being asked to live in a very different way. So I wouldn't be surprised if all of you were feeling a bit anxious and had problems with motivation from time to time, and were just finding life more challenging. I think it's really important to give yourself time and space to adapt. If I can draw from my own experience, I do so much work around student mental health because I really struggled with my mental health. As a student, I found life at university really difficult. I was also really surprised when at university, as a student, people didn't really talk about it. And so most of my work since university has been to try and encourage people to talk more about their mental health and how they're doing. And in general, I'd say my mental health is pretty good these days. I've learned to do a lot of things to look after my mental health, and I'm going to go through some suggestions. but despite that, Monday last week, I just couldn't get myself together, and I spent most of the day crying. And the more I